Hello there, I'm Kate Welsh. I'm here today with Dr. Matt Kulke, Chief of the Hematology Oncology Division here at Boston Medical Center. Matt, thanks for joining today.
Thanks.
You know, one of the things I was very interested in talking to you today, and one of the things I'm most proud of about at Boston Medical Center is the way that our cancer center has really made extra efforts to enroll a very diverse group of patients in clinical trials. You know, we serve a population that can be underserved, but it's also understudied. And here we have this pandemic that we know is disproportionately affecting the population we uniquely serve. And I wanted to talk a little bit about some of the experiences in the Cancer Center and some ideas that have come out from your faculty and others around campus to bring the state-of-the-art innovative thinking to this disease that so many people are struggling with.
This is a great example of where you really need innovative thinking. None of us have faced anything like this before. And it's been really exciting to see how the faculty are coming together and brainstorming about ideas that might be helpful. There was just one example. We had a faculty meeting by Zoom, just tossing around ideas. And one of our scientists brought up this idea that an old chemotherapy called etoposide might be useful to help decrease the inflammation in COVID patients. One of our other clinical faculty said, this sounds like a really rare hyperinflammatory condition called HLH that we use the same chemotherapy drug etoposide for. So lo and behold, over the weekend, a bunch of our faculty put together a trial protocol that we're now going to try to use in our COVID patients to help them to try to decrease this inflammation.
That's great. So we've heard that people who have had the disease could potentially benefit others because they've developed immunity, and people talk about, it sounds like a comforting term, convalescent serum. Can you tell me what that is? Do you drink it? No.
It's a blood product.
Okay, so you don't drink it.
You don't want to drink it. But patients who have recovered from COVID have antibodies to COVID. And the idea is that if you've got those antibodies, maybe they can be used to help somebody else. So by taking the serum, which is really like a blood donation, and then transfusing a patient who might have COVID, you're giving them the antibodies as a potential way to help them fight the disease.
And has that started at Boston Medical Center, or are we just beginning?
We're just beginning. We've done a few patients, and I think we'll be involved in another clinical trial with some of our other partnering academic institutions to look at this further.
That's terrific. And then I guess there's sort of old-fashioned clinical trials, a novel agent that may or may not be helpful in this disease, or an old agent repurposed for this disease. Are we involved in those kind of trials as well?
So we're looking at those as well. We have another faculty member who's very well known in another area called amyloidosis, as well as multiple myeloma, Dr. Sancharawala. Dr. Sancharawala has been involved in developing a new drug for that indication. It looks like through some other mechanisms that drug might also be helpful in COVID. We're going to be part of one of those studies as well through Dr. Sancharawala.
Well, that's wonderful. So her work is internationally known, so that hopefully will have the kind of impact that we need against this very challenging pandemic.
Exactly.
Thanks so much, and thanks to your team for all the work they're doing to help us all get healthy and stay well. Thank you.
Thanks.